I was one to get regular checkups, especially after I turned 40. Everything checked out great, and then one day he called me and said I had a elevated PSA count. I had a meeting with my doctor who explained it to me. He said that with a count that high that he would like me to go get a tissue biopsy because it could be a possible cancerous condition. Anytime anyone says you could possibly have cancer, I think everybody gets a little bit afraid. And I mean, cancer is probably one of the scariest things that a doctor can tell you that you might have. So I mean, there's going to be a certain level of anxiety. Also determined, let's get it done and let's see, and let's go on with whatever course of treatment we need to get on with. Because the earlier that you get treatment on something like that, if the test does come back positive, the easier the outcome and the better it is. So it was a no-brainer for me. I mean, I have known my primary care physician for many years, and I trust his advice. They put a probe up your anus, then they take 12 separate tissue samples off of your prostate after they numb it. It was uncomfortable, but 20 minutes of discomfort for peace of mind or finding out what happened, I think was a pretty good trade-off. Dr. Bentley kind of walked me through it. I mean, he told me when he numbed it, he told me when he was about halfway done, because I think he recognized that I was uncomfortable. Yeah, I didn't handle it very well. I went back to childbirthing classes with my wife, and I think I was practicing my breathing techniques during the whole thing. The worst part about it was probably the day leading up to it. Just the not knowing what it was going to be, if it was really going to hurt, and how uncomfortable it was going to be. And it wasn't that horrible. I mean, it's not something I would do on a regular basis if I didn't have to. But probably, the worst part was probably the fear of the unknown. He told me that I would have some blood in my urine, blood in my semen for, a month or two, which I did. But then, he just sent me home, and I think I got the results about a week later, maybe 2 weeks later. Nobody likes to have a test done and not know the results right away, so there was a little bit of worry, I guess. My wife tends to be very dramatic anyways, and I think like I said, she was probably making more of a big deal out of it than I was. But those results were negative, no cancerous condition. That it's not that big a deal. Just, it's 20 minutes of discomfort for, knowing, and if it had been a positive result where I did have cancer, I would have wanted to know about it right away. Be proactive about your health. Go to get regular physicals. Be proactive to find out if something is going on or if your numbers aren't good, and handle the problem before it gets worse. I mean, the earlier it's handled, the better the outcome.